Post-traumatic stress disorder, PTSD. Can medical cannabis be effective in managing symptoms? Presented by me, Han Nguyen. So what is PTSD? According to the National Institution of Mental Health, any exposure to life-threatening events that cause individuals to undergo symptoms of re-experiencing, avoidance, and hyperarousal for more than a month. 7 or 8 out of every 100 Americans will experience PTSD at some points in their life. So overall, PTSD is pretty common. The treatment for PTSD has two components: cognitive behavioral therapy and pharmacology therapy. Cognitive behavioral therapy is strongly recommended for treatment of PTSD. With this treatment, provider going to use various techniques to analyze, have patients reevaluate their thought patterns, reconceptualize their understanding of traumatic events, as well as assessing their ability to cope in order to aid patients in reducing symptoms and improve function. Now with pharmacology therapy, provider mostly use selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors. With the pharmacotherapy, unfortunately, remission rate for that remain to be low as 20 to 30%, which means up to 70% of Americans will have relapse at some point. Especially the record of relapse remain very high among combat veterans. So that leads us to the question, is there any way that we can do better pharmacologically wise besides SSRI and SNRI? Prognosis of PTSD is highly individualized as well. It's based on many factors: resilience, secondary stress, level of support, prior traumatic experiences, ongoing injury, severity of the stressor, and so on. So when talk about alternative solution pharmacology, what can we do? As of November 9 of 2016, 28 states in the US and the District of Columbia legalized medical marijuana, with 16 states approving its use for PTSD. On a record, worldwide, last year, our neighboring country, Canada, became the second major country in the world to legalize medical marijuana, as well as recreation use as well. That adds up to 22 nations legalizing cannabis for its medical purpose. So let's dig into medical marijuana and how does it work for our body, and available studies out there to support it. However, at the federal level, medical marijuana is still considered class Schedule 1 controlled substance, and its use remains prohibited. And that brings us to the challenge of conduct the study for medical marijuana, because it is strictly regulated by a lot of government institutions. There are numerous barriers researchers have to go through in order to grant it permission to conduct study. They have to go through the Drug Enforcement Administration, the U.S. Food and Drug Administration, the local institution review board, as well as the University of Mississippi National Institute on Drug Abuse, in order to receive federal grown medical marijuana. So that's why available study out there is not quite a whole lot, but we can go through some that I found for this presentation. So medical marijuana is active ingredient cannabinoids, activate endogenous cannabinoid receptors, modulating neurotransmitter release, produce a wide range of central nervous system effects, including increased pleasure, alteration of memory process, and this key component is the foundation for how medical marijuana is used for PTSD. So, according to the research by Beth Hauser and colleagues Individuals suffering from severe PTSD symptoms related to military experiences often use cannabis or cannabinoids as a means of coping, with some reporting promising benefits in terms of reducing anxiety, insomnia, improved coping ability. Another literature written by Statistical, Oliveira, Moore, and Almeida, some positive results exist for the use of medical marijuana in PTSD. Another study by Tuna and colleagues, one study showed an improvement in quality of life scale, the pain score, and the clinician administered PTSD scale for DSM-5 with a reported 2 to 3 milligrams of cannabis smoked every day. In another systematic literature review by Steenkamp and colleagues, there was a case report that documented decreased anxiety, flashbacks, and self-harm following medical marijuana use in a patient with severe sexual abuse-related PTSD. However, a lot of these studies have very similar limitation, which is majority of the study are not really well designed, and the sample is not really representative. Sample is pretty much small. They either target on the group of population, a combat veteran, and such. It's not a whole or sexual abuse related PTSD. So the sample is not really well represented for a majority of population. And a lot of those studies don't have long-term follow-up. A lot of them are survey, and there's a lot of confounding results. A lot of these findings is mostly the story, the report, but it's not a large sample randomized study. Because of medical marijuana is a Schedule 1 controlled substance, the use in a large sample size is pretty challenging. Fortunately, there's two groups of researchers have received approval to conduct such experiments. So these two studies are expected to be completed in 2020, and they can provide enormous knowledge on cannabis effects in a larger scale. So implication, as of this moment, we do see that medical marijuana become more and more prevalent within the United States, and the use particularly for PTSD has gained approval 16 states out of 50. So as a clinician, to obtain the knowledge about medical marijuana should be a must, because we might work with patients who have used medical marijuana in the past or currently using it to treat their own symptoms. So we need to learn to familiarize ourselves with the use of it. How does it work? What is the backup study, implication-wise? Even though PTSD can be very complicated and the treatment can be very individualized, there are cases when patients successfully recover from PTSD. And the key thing is to find the right kind of treatment and utilizing various necessary modalities. So medical marijuana, as a provider, we can view it as an alternative approach that we can use to treat PTSD as well. So that will brought to the end of my presentation, and I hope you enjoyed it. And this is references for my PowerPoint presentation. And a little bit more, and pretty much this is the end. Thank you for listening.